You are watching The Dawn Show live. Dr. Watts is in the house. You can call us. The phones are already ringing off the hooks here on live at WMCN TV. But we're talking about your body, your face, your looks. And maybe you're like me and you put on that red bikini that was in the drawer for too long and you said, ooh, dang, exercise is not going to fix this. So that's where Dr. Watts and plastic surgeons like Dr. Watts come into play. Thanks for being here.
Sure.
And you know, the biggest thing though that I want to point out is that you are somebody who's board certified. We remember the Kanye West nightmare when he lost his mother tragically because she went to somebody who was not board certified, and laws were even changed in California as a result of that. But you know, tell me, when somebody's shopping for a plastic surgeon, they've decided this is what I need to do. How do they investigate who's the real deal, who's certified, and who could be a danger?
Yeah, you know, Dawn, you bring up a great point here. You know, everyone tends to minimalize plastic and cosmetic surgery, and they kind of say, well, this is like going to the hairdresser. But really what you have to keep in mind, and we talk about how easy it is, and it's become that way, but it's really still surgery. And you're undergoing a medical procedure, and complications can happen. So it's paramount that you spend the time doing your due diligence and homework to find out that, one, they're a board certified plastic surgeon. You can go on the American Board of Plastic Surgery's website and it will tell you all of the board certified surgeons. You want to look at where they trained, okay, to make sure that they've had adequate training and they've gone to a reputable place. You want to check out how long they've been in practice because experience does matter in this case. You also want to make sure that they've had a lot of experience. You want to see their before and after photos, and not just one or two photos. You want to see, like I have, I don't know, 20, 30 photo albums, so that you get a representative view. How good is this person? Because really, your plastic surgeon's vision of beauty is what you're going to look like. So you really need to see what their artistry is, their artistic nature, how they view beauty.
But first, look at those credentials, which are critical. We've got Craig on the line who wants to ask about, I guess, pectoral implants. Sure. Craig, you're live with Dr. Watts on The Dawn Show.
Hi, Dawn. Hi, Dr. Watts. My name is Craig from Philadelphia. I'm a 33-year-old male. I don't really do the gym too often. Okay. However, I've been considering pec implants.
Okay.
I guess my question is, how do I go about that?
Sure. What you would do, Craig, and that's a great question. We do see that, and in guys, the two procedures as far as implants go would be, one, pec implants for the chest, and it's talking about the pectoralis major. And then the second one would be calf implants, because no matter how much you work out, it's always the calves are difficult areas to increase. So what you would do is come in for a consultation, we would take a look, and then what we would do is actually look at what size you would want to be, and then kind of go over how we would actually do this. We make small incisions, put the implants behind the muscle. It's very similar to the ones that we do for women, just not quite as large.
Okay, thanks, Craig. Thanks for calling in. Yeah, absolutely. Let's talk about tummy tucks, because this is the swimsuit season. A lot of people thinking about the little bulge or maybe the big bulge. And we've got some before and after pictures of your work, Dr. Watts. Can we take a look at the pictures? Tell us about this patient.
Now, you know, one of the big questions, Dawn, that always comes up is, am I a candidate for liposuction versus a tummy tuck versus both? And let's just go through and dissect this out. I'm going to give you a little plastic surgery tutorial here. When you look, see the stretch marks that you see on this lady's abdomen? When you see stretch marks, that's basically telling you that the skin elasticity is not good. So liposuction really wouldn't work, because if you just took the fat out, the skin is now going to hang. Not good. She also has quite a bit of fat around the flank regions or the love handles. It almost looks like she has a spare tire going around in that area. So she's really a great candidate for a combination procedure of a tummy tuck with liposuction on the love handles. And if we can go to the afters, and you can see how that works. Yeah,
that's amazing.
These are wow photos. You can tell it's still the same lady, because if you just saw these straight up, you would think you guys are doctoring the photos, but it's not. If you look on the right side of the screen, you can still see that fold in her back. That's how you know it's the same person. The incisions are low. You can see we keep them below the bikini line. You can see how the liposuction has brought in the flanks, and it just really reshapes that whole
That's
midsection.
amazing.
Yeah, it really is.
And what was her downtime? I mean, what's her recovery time?
Usually to go back to work, you're talking anywhere from about 1 week to 10 days. So the downtime is very, very short.
Let's look at the thighs. You
Okay.
got some, is this just straight lipo?
This is straight lipo on the thighs,
Because thighs are tough. The inner thigh is a difficult area.
The inner thighs are very, very difficult.
We'll do our exercises as we're talking.
That's
all
right.
It's
Now,
like-
on this one, this is an outer thighs. This is the
Okay.
typical saddlebag deformity that you hear about, where it almost looks like on a horse with the saddlebags.
Yeah, because her inner thigh actually looks great.
Yeah, she actually was very, very thin, and even if you see toward the top, her waist is fine. It's just that the fat tends to deposit on the outer
at that.
thighs. And this is the difference. And you know what? The key is in liposuction, from a plastic surgery perspective, is that you want to bring it down, but you don't want the patient to lose, as they say, those lady lumps. You still want to keep the curvature of the body, and that's what we've been able to do. So again, you're still sculpting. You want to make sure you take that fat in, but you still want the curve so that you still have that nice look.
Yeah, you do great work. She looks beautiful.
Oh,
I'm sure
thank you.
she's thrilled.
Yeah, she was happy.
All right, so one of my fears, you know, when you're well endowed and you've breastfed as long as I did with my kids, is having those National Geographic boobs. So we're going to show some before and after photos. You're not going to believe it when the Dawn Show continues.